Alright, so in the last video we covered the roots, trunks, division cords, and branches of the brachial plexus. And I had said that it wasn't as simple as just having the musculo-cutaneous, axillary, median, radial, and ulnar nerve. There's also a cascade of nerves that are coming off this, or a bunch of branches, if you will, that are coming off the brachial plexus. So in this video we're going to go into what those other branches are and what their name is and what they innervate. So coming down from C5, C6, and C7, this is your long thoracic nerve. Long thoracic nerve. This is going to be your serratus anterior. So another way to remember this is if you ever seen someone with a winged scapula, if this nerve is cut, 5, 6, and 7 causes wings to heaven, you'll see a scapula that's not inability to keep the serratus anterior has an inability to keep the scapula pressed flat against the back of the rib cage. So you'll see a winging of the scapula if this long thoracic nerve is damaged, and typically that would be you'll see damage to this nerve in people who have breast cancer. That's going to be a clinical correlate you'll notice when they do breast cancer surgery. They might injure this nerve. So that's going to be our long thoracic. Going up here, also coming off of our root of C5, this is going to be our dorsal scapular nerve. So the dorsal scapular nerve, this is going to innervate both the levator scapulae and the rhomboid major and minor. So this is dorsal scapula. You can imagine the trajectory of this is going towards the back from the axillary region, or from the neck, I should say. So the dorsal scapular nerve. And continuing down right here, we also have another nerve coming off. This is, so you have dorsal scapula. This is your suprascapular nerve. The suprascapular nerve is going to go to the supraspinatus, so above the spine of the scapula, and infraspinatus, below the spine. It is really interesting. You can actually see, if you were to look at the spine of the scapula, there's a hole in that spine that allows this nerve to travel and innervate both the supraspinatus and infraspinatus. So very interesting. And additionally, right here in our trunk, our superior trunk, we're going to have one more nerve coming off. This is going to be your lateral pectoral nerve. So this is what's going to innervate both your pec major and minor. So this goes through the pec minor and then into the pec major. So it's giving innervation to both the pec minor and major. It's very interesting. It's a very small nerve when you try to dissect that out. So then most books or videos, or I've noticed anywhere when someone's drawing the brachial plexus, they don't typically mention this one, but this is your subclavian nerve. Let's call it subclavian nerve. Reason why is because it innervates the subclavius. Subclavius is arguably a useless muscle. Doesn't really do much, so a lot of people kind of leave this out. But just for the sake of covering everything, we'll identify this nerve. And sometimes you can actually see this. So on the cadaver. So that's important, just so you know what you're looking at and you don't confuse it with something else. So then going down here, we're going to have 3 coming off. 1, 2, and 3. So first one, if you have a lateral pectoral nerve, you'll also have to have a medial pectoral nerve. The reason why I say that, remember this is brachial plexus is asymmetric, so you're going to have this on the right side of your body and the left side of your body. This doesn't mean that this one's going to the left side of your body and this one's going to the right side of your body. Don't get that confused. It's the lateral pectoral innervates both, while the medial pectoral only does the pec minor. So and again, this is not asymmetric. This is symmetric on both sides of the body. So then going right next to it, very interestingly named. Let's see, I might not have very much room for this, but we'll bring this down. So this nerve is going to be your medial brachial cutaneous nerve. Medial brachial cutaneous. Brachial meaning the arm, not the forearm, but the arm. The medial portion of the skin, and cutaneous meaning skin. So this is going to give innervation to the medial portion of the arm to the skin. So very appropriately named. And then naturally, if you have the medial brachial cutaneous, the next step would be medial antebrachial cutaneous. So antebrachial, that just means the forearm. It's a complicated way of saying medial brachial, brachial being the arm. Antebrachial is another way of saying forearm. So this is going to be the medial skin of the forearm is what this nerve is doing here. Very long nerve too. You should be able to see both of these if you're looking at a cadaver. Again, just like we had down here, we have 3 nerves coming off. Try spacing these ones out. 3 nerves coming down. So the first one is going to be your upper subscapular nerve. So remember, this is up here is your suprascapular nerve. This is your upper subscapular nerve. This is just going to innervate your subscapularis, the upper portion of it. Subscapularis being underneath the scapula. Your next one is going to be, I don't know why, everyone has like a favorite thing in anatomy. I love this nerve. It's just so fun to say. It's your thoracodorsal nerve. So it's all one word, but thoracodorsal, all one word, but I like putting the D in there so you guys can remember that name. So this is going to be your latissimus dorsi. So this is going to travel back towards your lats, and this is what's giving innervation to it. Don't know why. I love saying it. Thoracodorsal. I could say that 100 times. Thoracodorsal. Fun to say. Anyways, so the next one is going to be this third branch coming off the posterior cord is going to be your lower subscapular nerve. So lower subscapular nerve. So we have an upper subscapular and a lower subscapular. These are going to sandwich the thoracodorsal nerve. So that's one way to remember this. There's another name other people have used to describe this. I can't remember what it is, but you might see this referred to as a different grouping of names, but I just remember upper, lower, and thoracodorsal in the middle. So the lower subscapular has got 2 innervations. It's going to innervate the lower part of the subscapularis, hence the name lower subscapular, but it's also going to give the teres major innervation. And why does that make sense, right? So if you're looking at the rotator cuff muscles, you'll see that the subscapularis is closest to the teres major, and then teres minor is a little further down. So that makes sense. So when you're looking at the cadaver, make sure you look at this relationship, especially when you're looking at the sits muscles, which is muscles of the rotator cuff. Yeah, I believe that's all the nerves that are coming off the extra nerves. In subsequent videos, I want to go into more detail about where and what these guys right here are doing. These guys give all kinds of innervation to the rest of the body. So in subsequent videos, hopefully I'm going to go over that. I hope you enjoyed. Please let me know, give me some feedback in terms of what